Hello, my friends. This is Lynda Lippin, and welcome to the Pilates Goddess podcast. Go. Well, hello, everybody. It's your host, Lynda Lippin, and welcome back one more time to the Pilates Goddess podcast. I am very excited about today's interview. I think you guys all know about my history of chronic pain and the amount of arthritis that I have, and that I'm, having some knee surgery and whatever else. And I am always interested in talking to other professionals who have evidence-based ways of handling chronic pain, because there is just a load of shit out there on the internet about things to do with chronic pain. We can curse on the podcast, by the way, Rick, it's okay. And I'm here partly to help you guys wade through the crap and get to things that might really work. So today I am talking to Rick Olderman, the creator of the Fixing You method and the author of Solving the Pain Puzzle. Rick is a sports and orthopedic physical therapist with more than 25 years of experience. He specializes in helping people with chronic pain experience a pain-free life. Rick has written the popular Fixing You series of books found on Amazon to help people with chronic pain or injuries. And more recently, he has created downloadable video home programs to help people solve pain from head to toe. These programs include his pioneering approach that has helped solve hundreds of cases of chronic pain at his clinic for the last 10 years. Rick is one of the top professionals in the U.S. when it comes to understanding recurring injuries, which I think we all deal with, whether in our own bodies or our clients' bodies, and chronic musculoskeletal pain. He wants to enhance quality of life by helping people fix their pain once and for all. And his newest book, Solving the Pain Puzzle, is now out on Amazon. Welcome, Rick.
Thanks, Lynda. I'm excited to be here. We're going to have a fun time, I think.
I think we are too. And where are you?
I'm in Denver, Colorado.
Oh, lovely. Is it still cold there?
It's cool. It's a nice, cool spring day, but the tulips have bloomed or are blooming. And, soon enough, we're going to have unbearably hot temperatures. So I'm always happy with
right.
temperatures.
We're kind of in that place in New York. I'm apologizing to everybody right now. I will edit the podcast. We had an emergency in my neighborhood last night. A parking garage collapsed at 4 p.m. And they're still wading through the rubble of that because the structure is so unstable that they had to send in the robotic dogs.
Oh gosh.
Yeah. So that's what's happening in Lower Manhattan today. Newsflash. So, Rick, talk to me a little bit about how you got into physical therapy and why you started really focusing on chronic pain.
Yeah, well, I've always wanted to be in medicine, and I enjoyed fitness. And so physical therapy was just the natural fit for me. I certainly wasn't cut out for medical school. And I also had my own back pain. I was really looking forward to finding out what the insider secrets were to solving back pain. And that never happened in PT school. And I went into PT school with the underlying belief that for something that I'm doing is causing my pain. And I was looking forward to figuring out what that was. But that's not how we're trained in physical therapy and a lot of medicine. And so after I graduated, I had my first job in a rural town, and I did really well with acute issues, post-surgery, strains, sprains, all that kind of stuff. But when it came to chronic or recurring pain, I had no clue what was going on. And this was clearly the tools that I was given in school weren't enough to understand what's going on with chronic pain. I sunk into a deep depression because of it, and eventually moved to Denver to work at an elite health club and they had never had a PT on staff before. And so my schedule immediately filled with people with chronic nagging recurrent injuries. And these were people who were 20s to 70s, well-to-do, great insurance, had seen the spectrum of people that they could see, and still had pain. And that's when I realized, oh my gosh, it's not just me who's terrible at solving chronic pain. It's medicine in general is not solving chronic pain. All of these people are falling through the cracks. And so that's when I really decided I've got to try and figure this out. It was either quit or try and figure this out, because I was already in a deep depression. I couldn't go on being the same PT I was, knowing that I was just not going to be good at solving chronic pain when so much of that is what people see me for. So I thought, I've got to figure this out. And that's basically what the Fixing You method has sprung from. That's basically my story in a nutshell.
Yeah. I've been teaching Pilates and fitness now for 34 years. It's been a while. And the majority of my clients have had chronic pain, and it's the same thing. I've worked with a mostly, very well-to-do, is sometimes A-list clientele. I mean, I spent 4 years teaching at Parrot Key in Turks and Caicos, which is, an A-list private island. And even there, the majority of the people who came to see me had chronic pain of some form, whether it was musculoskeletal or, or unknown. Because there's a lot of unknown chronic pain out there. I mean, we now have diagnostic names for it, right? We'll say, oh, you have fibromyalgia. Well, what does that mean? You have chronic musculoskeletal pain.
Yeah.
Yeah. So what kind of tools have you used to help people?
Well, I again, my overriding idea was something I was doing was causing my own pain, and something all of these people are doing is causing their pain. Mm-hmm. So what I remembered was there was one instructor in physical therapy that I knew who addressed movement and pain, and that was Dr. Shirley Sahrmann. And she's a PT, PhD out of Washington University in St. Louis. She's written a couple of textbooks, generated tons of research, had taught there for decades at that school of physical therapy. And so I attended a lot of her seminars. I read her textbooks several times. And that was all about her thing is movement impairment syndromes. So movement impairment syndromes are movements that are contributing to biomechanical changes and pain in the body. And so when I learned her information, it was like coming home. It's like, oh, this is exactly what I think should be, taught in schools. And so, but that after a while, what happens in medicine, and you've probably encountered this too, Lynda, is that once you get good at solving a certain level of patient, the next level starts knocking on your door.
Right.
And that's what happened to me. And then I thought, okay, they weren't responding as strongly to this information as other people did. So I started to have to look elsewhere. And that's when I discovered Thomas Meyer's work in anatomy trains and fascia. And fascia, for those of you listening, is connective tissue in the body. And it turns out that there are superhighways of fascia that run through our body from our head to our toes. And again, that helped me look further away from where the pain was occurring to know what may be influencing that pain along those superhighways. And that helped. But then another tier of patients came by, and these people seemed to have a battery that was charging their bodies inside that were causing these dysfunctional patterns of pain. We could correct them, but the next day they would return again. And so there was some neurological event happening that's causing the body to be locked in these positions that we can't seem to get at. And that's when I discovered Thomas Hanna's work with Hanna Somatics. And he identified, and this is the really amazing part, Lynda, he identified 3 primary patterns of neurological pain patterns, which identified perfectly with Dr. Shirley Sahrmann's biomechanical model and Thomas Meyer's fascial superhighways of fascia. And when I got this neurological piece of the puzzle together, that's when my head just exploded. And just like, oh, I finally figured it out. I've got the fascia, I've got the biomechanics and anatomy, and now I've got the neurological. And so what all three of them I felt were missing was why these patterns were happening in our bodies in the first place. And so that's what I decided to figure out for the next 20 years or so. And so that's what the Fixing You method really is about, is these three areas and what we're doing that's causing these patterns of pain.
Interesting. So let's kind of start by talking about back pain.
Perfect.
Because we know that, 85% of Americans experience chronic back pain.
Yes.
Most people just think that back pain is normal and they should just live with it. From all of the, research studies that I've read, there's very loose correlation sometimes between like disc herniations and pain, even stenosis and pain. Sometimes you have something very obvious like a spondylolisthesis that's really slipping forward and that, requires some stabilizing. But I've had clients who have, had pain, have decided to just go the surgical route, had the best surgeons, went to Hopkins, did all the things, and still ended up on Oxy.
Yep.
Walking around with lots of hardware in their spine.
Yes.
And still having chronic lower back pain. And I find that most trainers and teachers are actually pretty ill-equipped with considering the number of people walking around with chronic lower back pain.
Not only that, Lynda, but medical professionals in general.
Yeah.
Right?
People don't know what to do with it.
Correct.
And then they'll do things, we were talking about this before we started recording, but what I'm seeing in different Reddit groups and different professional Pilates forums is that, doctors now are just sending their clients off to Pilates. Go do some Pilates. It's really great for back pain. They're not differentiating what kind of Pilates you should be doing, whether you should be doing a private or a group class. And so, teachers like at Club Pilates, where they're, trained in a few months and are teaching 12-person reformer classes, are getting people who, can afford to do that, have been told by their doctors Pilates will help them. And they're showing up with all kinds of pain and dysfunction. And these teachers have no idea what to do with them. Just none.
Frankly, Lynda, it's the same in physical therapy or chiropractic or massage therapy. The doctors are trying to send you, you're coming to them with a complaint of pain.
Yep.
And their first job is to send you to some kind of type of conservative care, right? Regardless of whether that's physical therapy, chiropractic, Pilates, training, massage, whatever, acupuncture, doesn't matter. And then they're hoping that something's going to stick when you throw that against the wall, right? And so, and oftentimes it does not. And so you go back to the doctor and they say, oh, well, whatever you tried, let's try this instead. And let's try that instead. Well, then, after you fail everything, they have no other recourse than to say, well, you're still coming to me with complaints of pain. The only other options we have are surgery, or I'll send you to a pain management doctor and you're going to take drugs or cortisone shots or things like that. So, there's often this idea that there's a conspiracy theory out there by medical doctors who just can't wait to prescribe medications. But that only happens as a last resort and is because you've already failed other types of conservative care. What else are they supposed to do if you're failing everything and you still want to solve this pain? But the reason that all of those things are failing is because we, at least in medicine, are not trained correctly to address chronic pain. And by that, what I mean is we are trained in medicine. We have 1,000 tests to identify a tissue that is damaged.
Right.
In physical therapy, we have all of these orthopedic tests to determine whatever that tissue is. We have x-rays, we have MRIs, we have CT scans, you name it, to identify a tissue. And then the idea is once we identify what that tissue is, we're now going to treat that tissue. But there are 0 tests that identify why the tissue was damaged. And so I call the training component thinking. because we're interested in that component of the body that has the damage, fixing the often small area around that component. And that in acute situations does a great job at solving pain. But in chronic pain situations, it does not. That's when we need systems thinking. And that's when we need to understand the body as a system. Unfortunately, we're not trained in medicine to understand how the body works as a system, which sounds crazy especially for a profession like mine, physical therapy. It's all about understanding the musculoskeletal system. We're taught the musculoskeletal system from a component thinking standpoint is the problem, right? As well as, and I've talked to lots of other chiropractors and massage therapists and so forth. We're all taught this way. And so this is why we have chronic pain in the world, is because of this component thinking approach to training. And so this kind of encapsulates why these people, and also then why the surgery fails for the spondylolisthesis patient that you just brought up, right? Because even though they have fixed the structural issue, they have not fixed the biomechanical issues that initially were contributing to the pain. And so, and so those hammers are still there because you haven't removed them yet.
Right. And, it's always amazing to me, like, I mean, I'm sure you've done this too. Sometimes you'll be watching, say, the Olympics and we're watching the gymnasts and the skaters, and you can tell, I mean, I can tell just by looking at them, which ones are going to need a fusion at some point, because you could just see some of those folks who have a very acute angle happening at their lower back when they go into a back bend or a flip. And, the fact that nobody seems to deal with that earlier.
Which is amazing.
It's truly amazing to me. Because then it would, give your athlete more longevity. Give your athlete a lot less pain, probably give your athlete better performance over the course of time.
By all means.
And instead they're just like, oh, look at that gorgeous bend.
Right.
And I look at that and I'm like, that's a spondylo.
So you had mentioned, talking about back pain. So what you're talking about is one of the two primary patterns that's causing almost all back pain. And that is that of excessive arching of the lower spine, or excessive forces trying to pull the spine into an excessive arch. So you can have a spine that's not arched that much at all, but have too many forces that are trying to pull it into that arch that causes the same type of pain. It would be like me pushing on you with my finger as hard as I could, and you pushing back as hard as you could, and neither of us are moving, but that doesn't mean that there's not tremendous force acting on both of us. Right. And that's how the body works. It's not, you can't dictate things based on shape alone. The shape gives us a clue, but you have to understand the forces. And so what I'd like to do is take your listeners through a quick test to understand one of these patterns in their body and kind of how I see it. Is that awesome? Would that be okay?
That would be great.
This is a really easy test, and you already know the answers to this test, Lynda. All right, but stay quiet until we get to it, okay? So I'm going to ask everyone to lie down on their back with their legs straight and feel and you can lie down on the floor, you can lie down on your couch, on your bed. A firmer surface will give you more input into your body, but it doesn't have to be of the floor. So you're going to lie down for about 30 seconds with your legs straight and feel what your back feels like here. And then I'm going to ask you then to bend your knees, either feet flat on the floor or knees hugged to your chest, and see how your back feels there. One of these two positions, knees bent or legs straight, will feel better for your back. Lynda, which position?
For me, it's knees bent.
Absolutely. You and 99.9% of all people with back pain. Yeah. And the easy answer would be to say, oh, well, my back is flatter when my knees are bent, and so I need to have a flatter back. But that's only part of the answer. So let's stand up now and try the second part of the test, because then you're going to understand a real fundamental behavioral issue that's happening, that's contributing to this pattern in you. All right. And by the way, this is called an extension problem, because your back is either in too much extension or too many forces trying to pull it into extension, or an arch, in other words. And so now we're going to identify what one of those behaviors is that's pulling your back into that arch. So everyone stand up and listen to the podcast for maybe the next 2 or 3 minutes. And you'll notice that after a minute or two, that your knees have started to lock straight in back. All right. And when we do that, and if they haven't done that already, go ahead and lock your knees back and feel what your back feels like in this position. All right. And if you're not sure, unlock your knees and feel what just happened to your low back. And if you're still not sure, lock your knees one more time and feel what just happened to your back. You will find that when you lock your knees, your back is arching more. All right. Now, there are many reasons why your back is arching more, which we can go into if you want. But this is showing us that, and you hopefully, that if one of your behaviors, which is unconscious to you, that of locking your knees, if you're standing for more than a minute or two, then contributes to the arching of your back. And we've already identified that arching of your back causes more pain. But it's not only standing behaviors, because we stand a lot less than we walk. So walking with locked knees also contributes to this. So every step then, when you lock your knees, then causes another hammer, extension hammer, to occur at your low back. So this is what these are the types of things I've been kind of drilling down into for the past 20 years are what are these habits that are promoting the patterns that are causing our pain? And there are 3 primary patterns, and the extension problem pattern is one of them.
Right. And then you take somebody who, say, is a little hyperextended or a little hypermobile.
Yes, hypermobile.
It took me, I mean, I think we all know the different kind of themes that have happened kind of in physical therapy and physical medicine over the years. Remember, first, everyone's back pain was caused by tight hamstrings. Then everyone's back pain was caused by tight hip flexors. Then everyone's knee pain was caused because we were locking our knees. And then we were supposed to keep the knees bent, and then you weren't supposed to bend them too much. And, kind of all of the things, in the last like 30 to 40 years. And because I'm hypermobile, immediately noticed that, obviously when I lock my knees, right now my left knee won't hyperextend because of the meniscus tear, which, is kind of an interesting positive in a weird way. But when I lock my knees, they hyperextend back. And my femur then shifts forward into my pelvis and causes my lower back to want to hyperextend. Right. I mean, so I feel that immediately. However, bending my knees all the time wasn't actually strengthening my knees. So it took me, I want to say, a solid 5 years to find straight, to just figure out my straight knee and get all of the muscles and all of the tissue around my hips and my knees to agree with that.
Yes.
And to be able to strengthen around the joint. And it took a long time, but it was so useful because once I did that, then I was able to stand and walk and do things in a very different way that didn't cause my lower back to hurt.
Yes, you're bringing up a really good point. So one of the reasons that people lock their knees is because it gives them neural input into their brain. They can then sense what's going on down here. And so when you stop locking your knees, you remove that neural input. And so you're a little lost. And so a lot of people will go the opposite too far and they bend their knees. But I'm not talking about bending your knees. I'm just talking about not locking your knees. Not locking the knees is all you need to do. You don't need to walk around like Groucho Marx, although your brain will be telling you when you unlock your knees that you are walking around like Groucho Marx, right? Because your brain's just like hyper alert to this primary postural pattern that you've set up for it, right? And now you're changing that. And so it's all confused and sending off all these warning signals, right? But you're absolutely right. We're not talking about bending. We're talking about not locking.
Right. And it becomes interesting actually in the Pilates studio, right? Because I'll get people say on the reformer, say, first session. And I, generally teach more classical Pilates. I learned, Pilates as a system.
Mm-hmm.
So we can go different places to do different things. And I'll say, when they're coming out for footwork and, on the old school reformers, like the Gratz reformers, there are no ball bearings in the wheels. So they have a little more, they stop. So you push out for footwork, the carriage is not immediately pulling in, even if you have all the springs on, because there's no ball bearings in those four wheels. So you have this moment where you can kind of stand there in a different relationship to gravity. And I'll say to folks, could you straighten your knee? No, you don't have to lock. And they'll say, but I thought I wasn't supposed to lock my knees. And I say, I'm not asking you to lock your knee.
Yeah.
I'm asking you to straighten your knee.
Right.
And these are different things.
Yes.
And then they'll look at me and be like, okay, I have no idea, what you're talking about. And then, obviously that then becomes part of the theme of the session and, and a lesson in what to do. But the majority of people walking around have no idea of the difference between straight and locked.
Correct. And so this sets up this whole pattern, and we can go deeply into the muscular and biomechanical changes that occur because of that, if you want to. However, I'd love to get into the second primary pattern. So extension problems cause usually unilateral back pain. All right. But there's another pattern that not unilateral, central. There's another pattern that causes unilateral back pain, sciatica and SI joint issues. And that is one of when a pelvis is resting higher than the other side, usually the same side rib cage is also resting lower. This is what I call a side bending problem. And you can imagine that when one side of the pelvis is higher and when the same side rib cage is lower, then you have increased compression on this side of the spine, from which the nerve roots exit that comprise the sciatic nerve. And so this is why it causes unilateral back pain and sciatic pain, and also SI joint pain, because there are other things that are going on here. So why is this pattern happening? Well, typically it's happening in response to some older problem in the same leg in 80 to 90% of the cases, or it's a compensation pattern for the opposite side in 10 to 20% of the cases. All right. So this is very easy to fix. We can fix it in about 10 or 15 steps. And I mean actually walking steps. We can solve this. All right. So that means that it's ultimately a gait pattern issue. And why is it a gait pattern issue? Because you have had some older injury in one of your legs that, while it doesn't hurt, you have developed compensations around, which allows it not to hurt. And that is now bleeding up into the back and pelvic area, causing dysfunction up here. So while this is easy to level, it will keep going back again and again unless you fix the root issue lower down in the body somewhere.
Yes. And I feel that in my body right now as a result of this left knee.
I was going to say, if you want, you can stand up. I might be able to see your side bending problem just live. But the easy way to test it yourself is if you take off your shirt and have someone take a picture of your back. Usually there will be some kind of a larger crease on the side of the side bending problem as opposed to the other one. Now, here's the really interesting thing. In neutral spine mechanics, side bending equals rotation to the opposite direction.
Yes.
So in most medical books in rehab anyway, this is identified as a rotation problem. And Dr. Sarman identifies this as a rotation problem too. And I tried for years to fix rotation problems, but they never fixed because the driver of the rotation is the side bending pattern.
Is the side bend. Yep.
And if you fix the side bending pattern, suddenly everything melts away.
Yes. Then the rotation
corrects
stops.
Itself.
Yeah.
Because you fixed the driver of the rotation. And so you maybe have been told by a practitioner, oh, you've got a rotated L4 on L5, or, a cervical, C2 on C3. Well, all of that rotation, the rotation doesn't occur on its own. The side bending of the spine is the driver of the rotated vertebrae. And almost no practitioners look at things like this way. And this is why we you have to go back week after week, and we are constantly dealing with our rotated vertebrae, right? Because no one's addressing the side bending, which is the larger pattern of issues driving the problem.
Yeah, and interestingly enough, a lot of this can be self-fixed.
Oh, absolutely. Yeah, that's why I wrote my original books like almost 15 years ago, the Fixing You series, to show people how to fix this in themselves. And, it works. But then I purchased my physical therapy clinic here in Denver. And, we were a really busy clinic, and I had several therapists that worked for me. And I demanded that no one could work at my clinic unless they understood the systems approach. And so I trained each of my therapists in this systems approach, because I needed to see, A, is it just me who gets these results? Can any therapist get these? And then B, it allowed me to see how their patients are responding to a systems approach. So now I got to see 4 different patients at once responding to this approach rather than just my patients, right? And so then I started to see, Lynda, that, oh my gosh, this isn't just happening willy-nilly in the body. This is happening in patterns. And once I understood that this was happening as a pattern of issues, solving it became so much simpler, because then I could anticipate what the other problems were because I identified the pattern, right?
Right.
And so then I thought, okay, if you go to my back pain book and my Fixing You back pain book, there's like 80 different exercises in there, right? To fix everything that could possibly go wrong. But once I understood that these were patterns of issues, now I could narrow it down to like 7 exercises. These 7 primary points are where most people are failing to cause this pattern. And so the pattern, like an extension problem pattern, can cause central back pain in one person. It'll be diagnosed as stenosis in another, spondylolisthesis in a third, disc bulge in another, disc herniation in another. It could be, unilateral back pain, but they all have the same pattern behind the manifestation of that pattern in their body. So to say and you said it right off the bat, that herniation does not mean that herniation is causing your pain.
Right.
It's the pattern that's creating the herniation that is causing your pain.
Right.
And so anyway, that's when I created my downloadable home programs, because now I figured out, I can make this a lot simpler now and get right to the point of fixing all of these systems problems right off the bat without guessing. And so that's what my downloadable home programs are doing now.
It's so interesting to me, because this is kind of where I've gotten to in my Pilates teaching, especially during, COVID, when I was only teaching online, right? And I still teach primarily online. And, when folks come and whatever else they're doing, say I get them on their back, and I'm like, could you just get your sacrum down and just get even weight on both sides of your back? Could we just try for that? Think about your hip bones being wide. Everyone wants to get down. They want to scoop in. They want to bring the hip bones together. And I'm like, if you're having some SI joint pain, I don't really think that's a place you need to go. I think we need to think about being a little heavy and stable and wide in the front of that pelvis. And then let's see what else happens in your body. And after doing that, a few times, they're just like, wow, that feels so much better. Are you sure we're still doing Pilates? Or, whatever I'm teaching. And I'm like, yes. And not only that, but now we're going to try that on all fours. We're going to try that in different relationships to gravity, because essentially that's really all exercise is for me, is, trying to find these these relationships, right? In different relationships to gravity and resistance.
Yes.
And that's what then allows folks to use them functionally in their day-to-day lives, which pretty much sounds like exactly what you're doing for folks, both in the clinic and the downloadable programs, and in the book is just saying, look, if you've got this, there's some kind of pattern happening here, and let's get out of that pattern.
So I would love to talk about like the biomechanic, the anatomical changes that are occurring because of these patterns, if you don't mind, because this will shed light on a cluster of other diagnoses and aches and pains that we have in our bodies. So when we lock our knees, this is an unconscious pattern that's occurring, and it involves a contraction pattern of some sort to lock the knees. All right. So often that contraction is happening from the quadriceps muscles or the thigh muscles, and the thigh muscles attach, into the knee joint, but they attach to the front of the pelvic bone.
The pelvis. Here, yeah.
Right. And so what happens is when you are locking your knees, even without the contraction of the thigh muscles, it tilts the pelvis forward. But because it's also contracting the thigh muscles, now you've added a load onto the natural pelvic forward tilt, which is then, of course, causing the back to arch more, right? So this is why thigh muscle stretching solves a lot of central low back pain, as well as sciatic pain, SI joint pain, and so forth, because what happens is often there's asymmetry in terms of how we're using our body. So one of the thigh muscles becomes tighter than the other, or one knee is locking more than the other, right? And so what happens is that side of that pelvis then is pulled forward more than the other side, which then introduces rotational torque across the SI joint bone and the lumbar spine as a consequence. Well, now that puts the lumbar spine into a constantly rotated position as well. And our spine doesn't like to be stuck in rotation, right?
No. And the spine stuck in rotation like that, I'm just imagining what's going to happen when you bend over and pick up a heavy object.
You're exactly right. Or even a light object. I mean,
or even
most
a light
back
object.
Pain, you know this, Lynda. Most people are throwing their backs out, picking up a sock, right? It doesn't even have to be
or turning around in their office to throw a piece of paper in the trash. Yeah.
So that speaks to less about how much load is in your hand and more about how you're bending over to pick things up. So the behavior of picking things up, typically, most people are locking their knees and then hinging at the hips, keeping the spine in that extended position. Well, if one of your thigh muscles are too tight, now you've got that rotation as well. You've got hinging at the L5-S1 as well as rotation on top of that. No wonder things are getting thrown out, And so anyway, so the thigh muscles becoming tight because of the knee locking is one of the things that's driving this pattern. So unlocking the knees is a great first step, but also at some point you have to address the thigh muscle tightness.
Right.
Now, what also happens when you lock the knees is that the gluteal muscles turn off. And so the gluteal muscles attach into the hip joint. They are the primary controller of the hip joint. And one of their jobs, they have many, is to create a pivot point around which that hip bone works. When the muscles turn off, then the hip bone starts to get sloppy in that socket, kind of like a washing machine that's out of balance. And it careens around in there, causing arthritic changes, labral tears, and so forth. This is called an anterior femoral glide syndrome. And this can lead to labral tears. It can lead to groin pain in the front. It can lead to bursitis pain in the side. It can lead to piriformis pain in the back. It can lead to global hip pain, like an arthritic pain. But it's all, the root of it is that the gluteal muscles have been turned off, ultimately because you're locking your knee, right? And so these are some of so you can strengthen the butt again, and you can stretch the thigh muscles. But if you don't stop locking the knee, the driver of those patterns of dysfunction, they're going to keep coming back again and again.
Right. And that's, I think, it in a way it keeps, your clients coming back, but there are so many people out there having these pain syndromes that basically if you can get some people fixed.
Yeah. Well,
then
my goal was to never have people come back to me again.
right, right. And what's interesting is historically that was really Joe Pilates' goal.
Mm-hmm.
He didn't want people to have to keep coming back all the time.
Right.
He wanted people to get better. That's why he kept saying, just put my equipment everywhere.
Yes.
Put it in the hospitals, put it in the schools, put it wherever you can.
Yeah.
And let's get people kind of balanced out and working well.
Yes.
So that, he was like, basically, if you just take my mat exercises, you can do them anytime, anywhere. And that's really what you need. That's about it.
Yeah.
So but now we're in that keep coming back forever mode.
Right. Right. And we've been lulled into that because no one else has been able to fix us. Oh, well, this practitioner is giving me temporary relief. I'm just going to keep going back again and again because that's the best I've gotten so far. Well, there's a whole nother animal out there waiting for you. And that is systems thinking approach. And it solves it. If you can solve how you're using your body, it will naturally solve the weakness issues in your glutes, the tightness issues in your thigh muscles, and the compression issues in your hip joint, the excessive compression in your spine, the rotation issues in your spine, all of this stuff. It's all of your body is responding to how you're using it. The problem is you haven't been taught how to use it correctly. And that's really what my fixing you approach is about, is fixing not only the behaviors, but the tighter, weak muscles that the behaviors have caused so you can rapidly get out of pain. But not only that, you've probably run into this too, Lynda, those people who keep coming back because of some tension pattern, their body seems to be locked. It also addresses the neurological tension patterns. I use somatics in my programs. Mm-hmm. And then finally, I also use taping techniques I've developed because no matter how hard we try, sometimes we can't get our body to do the thing it needs to do to get out of pain. And so that's where these taping techniques I've created support the body to get it out of pain immediately until you can fix function and then wean yourself from the tape. So it's a very comprehensive program in that regard.
Which is awesome. Because, I'm always a fan of a model that leads to client independence.
Yes, me too. That's what it's all about.
That's what people need. And especially, as we have an older population and we're living longer, right? So that's part of it is I think, what doctors are now looking at us and people are living, well into their 80s and 90s. And they're like, we're not sure actually what's going to happen because all of this is a pretty recent development that we've been living this long. Mm-hmm. And, my thing is, if you want the best quality of life for the longest term possible, you need to be able to self-correct and handle things on your own so that when you're on the plane or you're on the train or you're at home and it's COVID and you can't get in to see a medical practitioner if you want to, because there's so many other people with huge emergencies. It took to get any kind of orthopedic surgery now in New York City is like a 5-week wait. Mm-hmm. And not just for, a simple like cartilage trim, but I know people who are waiting on hip replacements and they're having a 5 to 6 week wait. Mm-hmm. Because everything is backed up and has been, for a while. That everyone then has ways of being able to correct patterns then, which then leads you to a better outcome after surgery anyway.
Yes, you're exactly right. And by the way, the last 2 testimonials I've gotten from I've created 5 different programs targeting different parts of the body. The last 2 testimonials I've received about my hip pain program, both women were scheduled for hip replacements. And within 2 weeks, were completely pain-free. One of them just emailed me again and say, she doesn't understand why she's still pain-free. It's impossible. And it's because she's using her body better.
Right. Because the doctor looks at the MRI and is like, your cartilage is gone and you're bone on bone and you've got
Right.
this arthritis and that. I mean, that's the first thing. So, with my
Yes.
story, that's the first thing he said to me.
Yes.
I walk into the surgeon, they look at the x-ray, they look at the MRI. Lynda, you have significant arthritis. I said, I know this. I've had significant arthritis. I've got it everywhere. I've got spine degeneration, all kinds of stuff, and I'm fine. So, they're like, well, we could argue for partial knee replacement now. And I was like, I know I have arthritis in my knees. They crunch, they do things, they don't hurt.
Mm-hmm.
I do the work. My knees don't hurt. My hips don't hurt. My back doesn't hurt.
Yeah.
So what I would like you to do is just get rid of this piece of cartilage that's sticking out that hurts. You can, and then he comes over and sticks his thumb in it. And I was like, ow. And he was like, yeah, it is that.
You mean this one?
Right. And then he just kept repeating, that this won't get rid of the arthritis pain.
Yeah.
And I kept repeating, I don't have arthritis pain. Yeah. I have pain because there's a piece of cartilage sticking out where it shouldn't be.
Yeah.
And I can feel exactly where that is.
Uh-huh.
And if you can handle that for me, which is quick and easy, then I'll get back to you if the arthritis starts to hurt,
Yes.
or starts to bother me in any way. I'm like, but this is actually aggravating the arthritis now. Because it's just causing a little more inflammation everywhere. And he was like, okay, that's fine.
Yeah.
And,
you just cut out there for a second, but this, you're right on. You're at, your body, Lynda, you're an expert in your own body. And that's how everyone should be. And that's why you can advocate for yourself. And
right.
This
and
is how everyone
doctors will
be.
let you do it. And,
yes.
and I think, people need to understand that, my husband was like, why didn't you go in sooner? And I said, because if I went in sooner, they would have made me go to physical therapy to get the range of motion and strength back in my knee to see if it still hurt. And I know how to do that.
Yeah.
So by the time I got there, I'm straightening my knee. I'm bending my knee into my chest. And they're like, well, where does it hurt? And I was like, right there. Oh, where the meniscus is sticking out. Right.
Yeah. Yeah.
But they were like, okay, we're not sending you to PT. Normally we would.
I just think
you don't
that's
need
beautiful.
it. You did it.
That's exactly how it should be. So good for you.
Yeah. So, you can advocate for yourself in that way, the same way, I could imagine one of my clients going in and being like, oh, maybe we should do that partial knee replacement. Now, I know for a fact that doing a partial will ultimately lead to having to do a total. It just will. Once you go in there with a bone saw and start to screw things around, they will need to do it again. And if that's going to happen, I just want that once.
Right. Yeah.
You go in once, you cause me all the pain, and then and then we get through that. But I'm not doing that multiple times.
Makes sense.
Right. And people need the knowledge. And I think what's great about what you do is you provide a lot of that knowledge for folks who may not know what's going on in their body, may not understand what's happening and what they can do about it. Because we know there are times when surgeries are indicated and when that kind of help needs to happen. But if we can kind of put that off and avoid that for as long as possible and still be functional and pain-free, I think that is like a win-win scenario for everybody. This way, the orthopedic surgeon can deal with you when you really need that replacement, maybe later in life, so you don't have to have it redone because replacements don't last forever.
Mm-hmm. Well, Lynda, this is one of the reasons why I wrote my recent book, Solving the Pain Puzzle, because people don't understand that, most of the stuff that they're listening and watching to out there, they think that that's the only solution, right? And so they have nothing else to go by. And so this book is kind of a gentle introduction to what it means to think from a systems point of view. And there are case studies that show how I've solved difficult pain from head to toe to use this idea. And this is what I've found, is that you've probably found this too with a lot of your clients, is that they're not interested in knowing the names of the muscles and the bones and all that kind of stuff, right? Well, that's what my previous series was. And that's what I've learned, is that most people don't want to learn all that stuff. So that's what this book is about. It's about the people. It's about the people's lives and how we worked with their body to change their life and fix their pain. And so it's a gentler, I think, easier thing for people to absorb, this information, like what you're talking about too. Understanding how your body works as a system gives you the power to be your own advocate and rule your own life. And that's what kind of the message is about this book too. We just don't know how to think about our body as a system, because all the information we've been hearing is coming from this component approach of thinking.
Right. So, Rick, this has been fascinating. It really has. How can people best get in touch with you?
Lynda, I think the best way is just go to rickolderman.com. There I have all of my programs. I've created a practitioner's training program. I've got free chapters of my new book if people want to read that. Links to Amazon, other free stuff. So that's the best place to dip your toes in the water and see what it is that I'm really talking about.
Right. And also, listeners should know, and all this will be in the show notes as well, that listeners do get 20% off of the Fixing You Method at Home course using the code Fixing You. So if this is something that you want to look at, what I always do is I go through the free stuff, and if the free stuff works and is awesome, then I'm happy to pay.
Go for it. Yeah.
Which I think is how most people work. So, guys, I really encourage you to get in touch with Rick, especially if you're experiencing a lot of chronic musculoskeletal pain, including back pain and joint pain.
Yeah. Thank you. And you too, Lynda. I mean, thank you for your great work. I mean, before we got on this call, I listened to your neutral spine podcast episode. I loved it. It was great. I'm just like, oh, she and I are going to get along really well.
Yeah. Because there are so many contemporary Pilates programs, and they're teaching these teachers neutral spine. And I think I tell the story in that podcast, but I have a friend who, had tailbone pain from pregnancy, from giving birth, and that went away. And then she started going, to her local club Pilates. And they told her that in neutral spine, everybody should have their lower back lifted 1.5 to 2 inches up off the mat. Oh my gosh. We'd talk about extension syndrome, right?
Oh yeah.
Let's just put people right in it. And I said, so you're sticking your tailbone out for the entire class? And she said, yeah. And I said, you think that might be why your tailbone's hurting? Because I do. And I was like, don't do that. Do not do that. Just don't. I said, when they say that, ignore them. And, I just told her, how I would position the pelvis and what to think about. And her tailbone pain went away. And she just ignores them now. Yeah. But that's the sad thing, is that they're still giving her the cues that she has to ignore.
Yes.
And if she didn't know me, she wouldn't know the difference and may have actually stopped working out.
Yes.
So let's just keep fighting the good fight.
Yes, exactly. Yeah. That's why I'm here. That's why you're here. So
yes. Yeah. All right. Well, everybody, as always, thank you so much for listening. I know that you could be spending your time in a myriad of ways, and you are choosing to spend some of your time with me at the Pilates Goddess podcast, and I am grateful for that. And as always, if you love the podcast, I would love it if you would go to Spotify, Podchaser, or Apple Podcasts and leave a rating and a written review. And I will see you guys next time. Bye. Thank you so much for listening to the Pilates Goddess podcast. Music brought to you by Nerd Salad. Please leave a review on Apple Podcasts, especially if you liked it. And please like, share, and subscribe wherever you listen to your podcasts. Thanks.